Myself Saroj Kumar, Senior Radiological Technologist. Today I will explain regarding SAP procedure examination in detail. Let's continue the process, be watching till end.
Hi, good evening. Today we'll discuss regarding the MRCP. In MRI, MRCP stands for magnetic cholangiopancreatography. It is basically used to visualize the biliary and pancreatic ducts. In this, how to do the patient positioning and procedure under, so we'll explain these things. First of all, we will make the patient ready in the hospital gowns, and accordingly that we will take inside the patients, and we'll use the respiratory grattings below the diaphragms, and we'll the body coils as you see in the image, and we'll wrap with the coils easily, and after that we'll give on the balance to the patient, and we'll give some instructions, breathing instructions to take breath to make it exercise, and we'll just giving him the one balance for the emergency alarms. If any conditions will arise in a discomfort conditions, in that conditions the patient will press and will come for the discuss with the patient. Now we are doing the positioning. The laser beam has been on, and just slowly the patient is going inside the gantry and just entering mid of the coils. We are proceeding the mid of the coils. After that we'll come back to the console room. Now we'll enter the patient details, names, patient ID, weight, age, sex, and after that we'll go for workstations number, the doctor's names, and exam descriptions, and we'll go for show all protocols. There we'll take the abdomen positions, and after that we'll do the routine examination. After that save, and after that go for the examination process. Now first of all we have to waveform, we have to indicate waveform, respiratory gating we have to on, and we'll take the examinations. First of all we'll take the 3-plan localizers, and we'll go for setup and save. 3-plan localizers arrives, and we'll make the planning. Randomly we have to make the planning of these things. In that we'll definitely see all the sequences, routine sequences in the MRCP which you are using randomly. So first of all we do planning of axial. If 3-plan will comes, corners, laterals and axial, if 3-plan will come, then we'll go for the planning of axials. Axial में हम लोग basically cover करेंगे liver to full area of liver until up to the lower portions, upper pole of the kidney you can cover it if it is required. Accordingly that you have to cover it. So we are doing the planning of axial. If you like do the planning of axial, then I have to go for save RX. Save RX means the planning finished, means we will save the once the image it will ready to act. And frequently we have to update the respiratory gatings, and if you will update the respiratory gating, accordingly that the respiratory motions will be simultaneously equality with the scan. So our scan time will be the reduced. And same way we will go for the planning of cornal T2 FS, cornal T2. See the planning I am doing, the randomly planning is going on. You can see if axial image will comes, and in that axial image we will drag and we will say adjust the contrast, and we will cover this scan thoroughly. You can see in the image, and it's very easy to do the planning under. So you should have to know the plane, axial, cornal and sagittal plane is mainly it requires to the planning. It's very easy, the MRCP, and the patient should have to instruct the breathing instructions to take proper the breathings. You can see the respiratory gating is moving inside, and just we are giving the seam coils to avoid the motion artifact any and the noise under. That should have the after before shaving we should have to update the respiratory gatings, and after that we have to go for the shave RX. If once we will do the save RX means its examination will be ready to act. This is the planning of 3D view. You will see the 3D plannings. 2D thick slab planning. This one is the 2D thick slabs. 2D thick slab basically we have to cover the CBD biliary trees, we have to cover, and accordingly that we have to do the plannings. And this breath hold sequence is there. we have to make the patient to breathe holds for the 8 to 10 second centers. Accordingly that we will take the 15 to 17 slices. As per requirements you have to take the slices in this. This is a 2D thick slab, most important sequences in the MRCP. After that we will go for the 3D. 3D is the most important sequences, thin sections. You see the slice thickness 0.8 mm will be the slice thickness, and basically you should concern for this planning go on the axial image. You should go on the axial image, you should cover the CVD and pancreatic ducts. Accordingly that you have to do the planning. You can see the 3D image. This is the last 3D image which I have done. Very nice image it's coming there. So you can see this is the reformat image we have performed this.